Hi, welcome back. We're in session 2 and we're going to review the champion binder. So if you can open your champion binder and get your champion handbook out, we'll begin. Start by going to page 1/1. So work your way through the first few pages, which are Roman numerals, which talk about some of the things we talked about in the earlier session, and head on over. All your institutions, facilities, etc. have signed a letter of agreement stating that your management has agreed to work with you to help make this program a success. I also want you to go to the worksheet on Appendix A, and Appendix A is on page A/1 or A-1. This is something you and your team can work on together. It's an orientation worksheet. What it will help you do is align your facility vision with ours. It will help define objectives that you hope to accomplish with this program. Also, it will look at some of the barriers and some of the bridges to making this program a success. And then finally, an action plan so that you can hopefully accomplish some of these objectives that you've set out for your team. After this session, you and your team can work together on this worksheet. On page 1.2, you will notice that we ask you to go to Appendix F, and that is on page F-1. On that page, you will find a contact sheet that you need to fill out that will help you communicate with the support team leader. It will help you with ordering materials. It gives you conference call numbers and the names of other cohorts in your group. It also has important web information. This is important to fill out on your first conference call with your team leader. We're now going to take a look at some of the job descriptions and the program framework and timelines. All of you will have a CAWC cohort team leader. Her or his role is to conduct the initial orientation and is a resource for you for your educational programs. They will also provide ongoing support through the discussion forum, through conference calls, and through phone inquiries. Your team leader will tell you telephone times or times that are best for them to connect over the telephone. Occasionally, the team leader may also connect with the administrators of the facility or home. They will also help you with evaluation. Regular feedback is so important to make sure that we can keep on track with the progress of your program. And also, they're a resource for prevalence and incidence collection. Healthcare administrators play a key role in this program. We really need that management support in order to enable the program to be as effective as it could be. We want you, the administrators, visible at kickoff events. We want you to support the staffing, the education, and the resources that might be required for prevention, as simple as enabling more pillows for positioning. We also need policy development. Nothing says mandatory more than policies in place to ensure that protocols are followed. Also, to support teamwork on the units. We really must have the involvement of not just the nurses, but occasionally the occupational therapists, physical therapists, social workers, dietitians, physicians, and anyone else that may be required in order to prevent pressure ulcers. The Site Champion team is a team that is supported by management. We need enthusiasm, we need a positive approach to care, we need knowledge, and they need to be accessible to the staff as coaches for the program. They need to advocate for the program and be accountable for the implementation and accountable to the team leader for the progress of the home or the agency. Be fearless. Become a warrior for prevention. Remember, you're not alone. You have a team, and you also have the team leader for the PUAP program. The membership of your team should be from many different disciplines. You need to identify communication strategies. For example, if one of you is the primary contact for the national team leader, for the cohort team leader, you need to designate a secondary person that could be available in your absence, because occasionally you do take holidays, there is sickness and time off. So make sure you have a designated plan within your team so there's always somebody who's available and accountable. What are the benefits? Well, you develop and enhance your leadership skills. You are making practice change. You are ensuring best practice is being implemented in your home or in your facility. And you can base your practice on the most up-to-date wound care prevention and management evidence available. We will modify this program as changes occur in the evidence. But the bottom line, it allows you to take action and make a difference.